Well, that's good.
Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and my next special guest, Dr. Stephen Garner. Dr. Garner, thanks very much for being here.
It's a pleasure, Dr. Morwood. Thank you for inviting me.
Dr. Garner, you have impressive credentials, I must say. We get to introduce this concept of being double board certified. Now tell me, you have boards in both ENT and plastic surgery, is that true?
Yes, in order to be eligible to train in plastic surgery, you have to do some prerequisite training. You mentioned earlier that you had done prerequisite training in general surgery for several years before going into plastic surgery. After 1 year of general surgery, I then did an ENT or otolaryngology residency, which I finished and took my boards in, but decided I did not want to practice in that specialty and wanted to go into plastic surgery, so I went and did a separate residency in plastic and reconstructive surgery with you.
At USC?
At USC.
Well, and Dr. Garner, not only did you do plastic surgery residency, you went on to do a fellowship.
Yes, I did. I did a craniofacial and maxillofacial surgery fellowship with Dr. Anthony Wolf in Miami.
Well, Dr. Garner, I must say your credentials are impressive. So, Dr. Garner, about the subject that I want to talk about today. You know, in my office and in my practice, a lot of people come in, and of course they want to look better, they want to look more refreshed, they may want to look younger, but they're not quite ready for surgery, or they may not want to take the time off to have surgery, or they may not want the expense that comes with surgery. So they start to ask about things that are less invasive, like Botox and fillers, and sometimes laser. So let's talk about Botox today, if we may. I understand that you are one of the heavier or biggest Botox users in this part of California.
We have a very busy and active practice. I have a team of nurses that participate in my practice, an excellent team at my skincare med spa, Ultraderm in Santa Cruz. And yes, it's a growing industry. I believe that in the United States now, Botox injections are the single most common cosmetic procedure that people have done, and the growth curve is still quite steep year after year.
So I do want to get onto that, but before we talk specifically about Botox, I do want to talk about your office setup. And I visited your office and I'm very impressed. So on one side of your building, there's your surgical office, your plastic surgery office, and on one side, it's really skincare and Botox, and that's called Ultraderm?
Ultraderm.
Well, that's very impressive. So people can go in and they can go to one side and get their Botox, and they can go to the other side and talk to you about surgery. So let's zero in on Botox. I want to talk about what Botox is and what it does. What is Botox?
Botox is a medicine that can be injected into muscles of the body. It acts by preventing the muscle from contracting in response to a nerve impulse. Much like an electrical appliance where an electrical cord goes into your fan or your radio, there's a point where the nerve connects with the muscle, the motor end plate. And Botox interferes with the stimulation of the muscle at that level. It's a temporary effect lasting anywhere from 3 to 4 months. And Botox was originally used to treat spasm in the face, sometimes people who have involuntary spasm of muscles in the face, or even for abnormal muscle movements around the eye. And it was by coincidence in injecting people who had spasm around their eye that the treating physicians noticed, hey, the crow's feet got a little bit better on the side where we treated. And from that observation and experience, Botox began to be used exclusively or in isolated cases purely for the aesthetic benefit. But Botox is still used extensively for other kinds of medical problems, whether it's muscle spasms in the neck or now even sometimes in the esophagus or other parts of the body. Wide range of medical use in addition to the cosmetic use.
Okay, so the Botox doesn't really zero in on the nerve. The Botox affects the muscle, so when the nerve tries to stimulate the muscle doesn't contract so much or it releases the spasm. Is that right?
Yes. It really, as I said, it was at that microscopic junction of the nerve and the muscle called the motor end plate.
Okay, so let's talk about some specific uses for Botox for cosmetic purposes, let's say in the face. What are common areas where a person might want to have muscles in the face relax?
Certainly the most common is the area right between the eyebrows that we call the glabella or the scowl lines. And sadly, I can demonstrate that pretty well by scowling. We get the vertical lines here that sometimes people call the 11s, and that's due to a couple of small muscles that pull the eyebrow down and in. And that is the most common location for people to have Botox injections to weaken those specific muscles so that you don't get the scowl lines or the 11s.
Okay, so let me back up just briefly. You know, in my practice, I would say for cosmetic surgery, only about 10 or 20% of my patients are men who have facial cosmetic surgery. But I think for Botox, it's more like 30 or 40% of my patients are men, simply because that I've heard men tell me that their colleagues or their coworkers or people they work with think that they're angry all the time, but they're not angry just because they have those so-called scowl lines. Isn't that? Do you
It
find
is
that?
a very common presentation in men and women also, and that they do complain of people thinking that they're angry when they're not.
Okay, so besides the glabella, so the glabella is that area between the eyebrows where we can soften those sort of scowl lines, or what you call the 11s. Now you mentioned crow's feet.
Right.
I think that's another common area.
There is a whole sheet of musculature, as you know so well, in the face and even extending down onto the chest called the mimetic musculature. Most of the muscles in the body are deep muscles that move the bones of the body, but you've got this thin layer of muscle in the face and neck that just moves the skin, your muscles of facial expression. And the body forms skin wrinkles often perpendicular to the line of pull of the muscle. So there's a circular round muscle around the eye, and that it closes like a sphincter to help squeeze the eyes shut. And when it does that, it creates the little spokes of a wheel lines that we call crow's feet. So that is probably the second most popular area where people come in to have Botox, is to get a little bit around the area where they have crow's feet.
Okay, Dr. Garner, I really appreciate this, but I hear two common questions in my office. People want to know, does it work? And number two, they want to know, is it safe? So first of all, does Botox work?
The answer is absolutely yes, it does work. And the answer is yes, absolutely, it is a safe and approved and reasonable medication that's used. I strongly endorse it being used in appropriate medical settings, and that people go to a qualified practitioner. Certainly the newspaper reports that sell the most newspapers are when something bad happens. And very often that's due to unscrupulous practice. Someone who is using an inappropriate medication in an inappropriate way, or somebody who isn't licensed or appropriate to be using it in the first place.
Okay, now this is something on this program that I've tried to emphasize, that I suggest to people that they look for someone trained in any field they're interested in, and hopefully to be board certified. So Botox in your Ultraderm clinic or in your plastic surgery office is injected exclusively by MD, you're the MD or the RN who's trained in this injection process.
Yes.
Now, another question I hear is it a replacement for surgery? Now, I know that's kind of a tricky question because there's many different operations that we can do on the face, especially around the eyes. We can do brow lifts, we can do blepharoplasty, which is eyelid surgery, we can do little tucks here and there. Dr. Garner, in your practice, if someone comes in and asks you, is Botox a replacement for surgery, how do you counsel them about that?
It sometimes can be an addition to or an adjunct to the surgery. It sometimes can be an alternative, and sometimes it's not just an alternative, but it's the correct alternative. Most commonly, you were talking about brow lifting, where someone is having an operation to try to elevate the eyebrows and improve some of the wrinkling in the forehead. Very often in brow lifting, some of the muscles that we treat with Botox with injections are divided surgically, which can provide the equivalent of a permanent Botox effect. If somebody comes in to see me and they're complaining primarily about their glabellar scowl lines, I will talk with them about what their treatment options are. I'll explain to them, here's the anatomy, and I show them pictures because I find that most of what we do in medicine isn't that complicated. If you really just take the time to explain it to people and show them a picture of the muscles, it all makes sense when you see it. And then I tell them what their treatment options are. I say it's possible that you can have these treated surgically. Another option is that they can be treated with medication, Botox, injected into the muscle. And we talk about the risks and benefits of each, and I offer my opinion and my counsel based on the individual needs of the patient, and ultimately they make all the decisions.
So frequently in my practice, in my office, I'll see someone who might be in their 20s or 30s who's very reluctant to have surgery, but they are certainly willing to consider Botox or fillers or maybe even laser.
Very often I have patients, if they're on the fence, I suggest, why don't you try the Botox first? If you like the effect, you like the way it looks, you have the option of coming back for repeated Botox treatments, or you can always make the decision to proceed with surgical treatment at a later date. It doesn't burn any bridges to try the Botox.
Okay, now that reminds me of another question that I find interesting that I hear in the office. People will ask me, if they start to have Botox, does that mean they have to continue having it forever? Like, do they get hooked? Or somehow, do they have to come in every 6 months the rest of their life?
The answer is absolutely not. No more than do you have to continue to color your hair. You can treat once and never do it again. There's no long-term adverse effect on the body. There's no dependency that's built up. Certainly, people can build up a bit of an emotional attachment. They enjoy it, but I wouldn't consider that then a medical necessity. That's just a desire.
Dr. Garner, you know, one of the things that I haven't done a scientific study on, but I've begun to observe that if somebody, say, let's take the glabella, if somebody has 3 consecutive Botox injections, like 3 to 4 months apart, it seems to me that those muscles get so weak that they don't ever recover their original strength. Have you noticed that?
I've had a similar observation, and I've looked carefully in the literature, and I have not yet seen good clinical studies documenting that. We certainly know from many other kinds of medical problems or injuries that when a muscle isn't used for an extended period of time, it can undergo changes which make it harder for it to come back in the future.
Right.
So yes, I've shared that observation.
Now, what about Botox below the levels of the eyelids or below the levels of the cheek in the face? You know, I think the use of Botox around the mouth has sort of a checkered history or checkered experience by patients. Sometimes it can work well, other times it makes people look unnatural. What do you tell women, say, or men, for example, if they want to soften the nasolabial folds?
I'm glad you brought up the natural look, because frequently in entertainment films, television, movies, we see jokes about Botox, people with the deadpan face. That really is just in the movies, and it's extremely unusual to see anybody who's been treated with Botox in the real world who has that kind of appearance. It is possible for Botox, when not used appropriately, to cause some mild asymmetries or changes around the smile, but Botox is now used very commonly around the lips to soften vertical lines on the lips, and often in the chin. Sometimes people have bunching up of the soft tissues on the chin, and that can be very effective in treating that, which sometimes a term used in other areas of the body, peau d'orange, orange peel appearance of the chin. Also, bands in the front of the neck from one of the mimetic muscles, the platysma muscle, can be effectively treated with Botox in many patients.
Okay, Dr. Garner, so maybe we could mention, again, some of the so-called reconstructive purposes that we can use Botox with or for. So, for example, blepharospasm, or for adults or even children. I recall using Botox for children at Children's Hospital in Los Angeles when I was in fellowship, who have like hemifacial paralysis, and we try to balance out the face. Can you mention some of those uses?
Absolutely, and I do recall the same experience with our mentor, Dr. John Reinisch, at Children's Hospital in Los Angeles. Children with different kinds of facial paralysis, it's the asymmetry that's most noticeable. Sometimes the easiest and best way to correct that is to treat the area that's weak, but sometimes if you can lightly weaken the other side, it still looks natural and provides the patient with a much easier option for recovery. As I mentioned, Botox is used by ophthalmologists sometimes to treat muscles inside the eye socket. It's often used for muscle spasms in the neck. Botox has been used for people with, or sometimes referred to as muscle headaches, from tightening the muscles around the face to treat headaches. Much of this is in a steep learning curve process as we gather information. Botox, because of the way it affects the nerve connections to different things in the body, can sometimes be used and is being used for treating excessive sweating in the palms or under the arms. I personally do not have experience with that.
You know, I've done that a few times, and I think it works great for people, especially what we call hyperhidrosis, excess sweating in the armpits or the palms. I think it really does work very well. And again, we've used it for things like spastic paralysis in the hands or even lower extremities. So I think it's a very valuable adjunct. You did mention that it is safe. Are there things that you tell your patients that they need to be careful about, or that you want them to know about the side effects?
Well, in preparing for our chat today, I went and looked at some of the history of Botox and found it very interesting that the original description was from scientists in Germany, and the term comes from a Latin botos, meaning sausage, because the chemical is produced by a microorganism that, when it grows in rotting food, can cause a disease called botulism. What's important for people to understand is this isn't injecting botulism into the body. It's isolating one of the proteins that is produced by that microorganism. And the best analogy that I offer is penicillin. Penicillin was discovered from a mold growing in a laboratory, and it was seen that that microorganism produced a chemical that could fight infections.
Well, Dr. Garner, I so appreciate you coming on the program. I know you're highly qualified. And again, do you have a website or a phone number that you're in Santa Cruz?
Yes, and our med spa in Santa Cruz is Ultraderm. I'm Dr. Stephen Garner. My website is garnermd.com, and we're listed in the phone book, 831-475-3076.
Dr. Stephen Garner, Garner. Thanks very much for being here. I sure appreciate it.
Pleasure, Dr. Morwood.
Please
nice
come
to see
back.
you.
This is Your Health radio and television program. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and we're going to come right back after a very brief pause for a very good cause. Thanks for being here.